Hi everyone, I'm Miriam, and today we're diving into a group of infections. The NCLEX never gets tired of these. These are the torch infections. These are sneaky little pathogens that can tiptoe through that placenta and cause serious problems for that fetus. Think of torch like a lineup of troublemakers, and our job is to spot them fast and treat them even faster. The NCLEX isn't just testing infection facts here, they want to know if you can break that chain of transmission. Ready? Let's get started. So what exactly is torch? Well, it's a collection of infections that can cross that placenta to be transmitted at birth and lead to congenital defects. A lot of these we can screen for during pregnancy so that we can intervene early with treatment, teaching, and any specific birth plan that's needed. If the mom contracts any of these, our goal is to obviously prevent transmission to that fetus as much as possible. Let's break it down letter by letter. First up, the T, and that means there's trouble around cat litter. So that T is Toxoplasmosis, and it comes from the protozoan Toxoplasma gondii. How does it reach a pregnant client? Well, that's going to be through undercooked meats, contaminated soil, and cat feces. The fetus can develop microencephaly or a small head, usually from improper brain development, or hydrocephaly, which is that excess cerebrospinal fluid that builds up in the brain's ventricles. So prevention is everything here. So what do we teach? Well, if it's found in cat litter, then we would tell pregnant clients to avoid cat litter during pregnancy, right? These mamas are off cat cleanup duty. Since it's found in undercooked meats and contaminated soil, clients should also avoid undercooked meats and wash their fruits and vegetables and of course their hands after gardening or handling any raw foods. That soil can get contaminated because any outdoor cat could use the bathroom in that soil and contaminate it. So remember, no cat litter duty while pregnant, and the NCLEX loves this, so think Toxo travels through Toxo litter and undercooked T-bone steaks. All right, T was just the warm-up. Let's move to the big umbrella category, and that's O for other. This is going to be those other infections, and the ones we're going to focus on are HIV, hepatitis B, and GBS. Let's start with HIV. HIV is passed in utero during delivery or through breastfeeding, and that newborn can contract HIV. Here's your NCLEX checklist for interventions. We want to screen all pregnant clients for HIV. We'll give them antiretroviral or ART during pregnancy and labor. They're going to need to be prepared for a cesarean delivery if that viral load is high. And even if that viral load isn't high, all clients are going to be unable to breastfeed. Breastfeeding is contraindicated for all HIV positive clients because HIV spreads through the body fluids, right? So it's in that breast milk. We're going to bathe that newborn immediately if it's stable because we want to remove the mother's bodily fluids from that baby to decrease the exposure risk. And we'll administer ART to the newborns within 12 hours of birth. And of course, we want to teach them the importance of follow-up testing for that baby. What about hepatitis B? Well, the newborn's exposed during delivery through maternal blood or fluids. And how will we know if that baby's been exposed? Well, all moms are screened during pregnancy, so if that mom is hepatitis B positive, then our priority is to give hepatitis B immunoglobulin or HBIG and the hepatitis B vaccine within 12 hours of birth. So remember, hepatitis B positive mom, hit that baby with HBIG. What about group beta strep or GBS infections? This is another NCLEX favorite. GBS is a normal bacteria in that vaginal flora for the mom, but it's dangerous for the newborn. This transmits during delivery and it's dangerous to that baby, so it can cause sepsis, pneumonia, late meningitis, and even death. So what's your NCLEX checklist for this? We want to screen all moms between 35 and 37 weeks, and we want that mom to understand that GBS is just part of that normal vaginal flora and not dangerous to her. But when it's over a certain threshold, she's considered GBS positive, and this increases the chance of a GBS infection to that baby. So if mom is GBS positive or unknown, we need to administer IV antibiotics like penicillin during labor, and this is going to decrease that bacterial load and reduce transmission to that fetus. Now, before we keep rolling to the R for rubella, let's do a quick check. Pause and answer. What 3 things should pregnant clients avoid to prevent toxoplasmosis? Remember, toxoplasmosis is a protozoa that lives in cat feces, undercooked meats, and contaminated soils. So clients are off cat litter duty and must thoroughly cook meats and wash their fruits and vegetables and hands after gardening. Can HIV positive mothers deliver vaginally? Can HIV positive mothers breastfeed? Well, this is going to depend. They can have a vaginal delivery if that viral load is low. Otherwise, a cesarean delivery is going to be recommended if that viral load is high because there's more of a chance of exposure through that vaginal delivery. And breastfeeding is going to be contraindicated for these clients because HIV can pass through that breast milk. How do we prevent mother-baby transmission of hepatitis B and GBS? Remember that if mom is hepatitis B positive, then we are going to stick that baby with HBIG and the hepatitis B vaccine within 12 hours of delivery. Moms that are GBS positive or unknown should be given penicillin to prevent neonatal GBS infection. Do you remember how rubella spreads? Well, rubella spreads by droplets to mom, and then that can cross that placenta to the fetus. Newborn risks? Well, things like hearing loss and intellectual disability. So what do we do? Well, we need to screen for rubella immunity by testing titers during pregnancy. If they're non-immune, then they're going to need that MMR vaccine, but we cannot give that MMR vaccine during pregnancy. This is really important to remember. This is a live vaccine, which means it's contraindicated during pregnancy. So after that baby's born, we're going to administer the MMR vaccine, and we're going to teach her that she needs to avoid pregnancy for 1 month. And that's because we need time to ensure that her body has time to build strong immunity against the rubella and to prevent this live vaccine from harming a developing fetus during that time period. And if they had to get the Rh immunoglobulin or RhoGAM shot postpartum in addition to rubella, then they'll need to have their immunity tested after 3 months because Rh immunoglobulin can suppress that immune system and prevent antibody production. Do you know how clients would pick up cytomegalovirus or CMV germs? Well, CMV is an opportunistic infection and it spreads through saliva and urine, usually from young infected children. The fetus is at risk for hearing loss, microencephaly, and even death here. This one is horrible because young children in the family can bring home these germs and expose their pregnant moms. So what can we do? Well, to prevent this, the clients are going to need to perform strict hand hygiene. And that's of course important throughout pregnancy anyways for everyone, but especially after they've come in contact with diapers or saliva. Remember, these young toddlers are drooling on everything. And if that mom's just picking up toys and playing with their child or getting slobbered all over by her child, then she's going to be at an increased risk for this. So it is really important to stress strict hand hygiene. So for CMV, think children's messy virus, saliva and urine. Now finally, the H in TORCH, which is Herpes simplex virus. HSV1, 2, which is which, and are they both a risk? HSV1 is usually oral. HSV2 is genital, and both can be dangerous to newborns. Newborn risks include local infections like skin, eyes, mouth, or it can become disseminated and affect multiple organs. Now, these NCLEX interventions are really important. All clients with HSV1 or 2 will get suppressive therapy with acyclovir in the last trimester, even if it's just a history and not currently active. We're going to deliver via cesarean section if there's any active lesions present, and you must consider that newborn infected and follow contact precautions. We want to make sure to teach the client to avoid breastfeeding if there's any active breast lesions and avoid kissing their newborn if they have any active mouth lesions. Now, when these babies are born to an HSV positive mom, it's critical to be assessing that newborn frequently. They can get so sick so fast and die if it's not caught. They might get one small lesion that's seen on assessment, or they could even seize because that virus can attack the central nervous system and cause encephalitis, or it can even infect the lungs and cause respiratory distress. If a newborn is suspected of contracting HSV, if their little bodies do anything funky, then they're going to immediately be started on IV acyclovir. We had a baby born once where the mom was HSV positive and it was unknown. She didn't have any lesions that were spotted by the healthcare provider. And by the time the doctors realized that the baby's respiratory distress was from herpes, it was too late. So it's really important to be assessing these babies and know that mom's history as best as you can. All right, time for your next quick check. Pause and answer. True or false? MMR vaccine is safe to administer during pregnancy. False. Remember, it's a live vaccine, so if mom is rubella non-immune, we wait until after she's delivered to administer this. How is CMV spread, and how is transmission prevented? Remember, CMV is children's messy virus. It's spread through saliva and urine. And remember, we need these moms to perform strict hand hygiene, especially after handling diapers or slobbery toys. What should a mother with active HSV lesions avoid? Well, she should avoid vaginal deliveries if there's any genital lesions and deliver via cesarean section. She should avoid breastfeeding if there's any active breast lesions, and avoid kissing that newborn if she has any active mouth lesions. All right, let's bring this all home with a rapid fire review. Toxoplasmosis, avoid cat litter and undercooked meats. Other, HIV, we're going to give ART therapy, deliver via C-section if there's a high viral load, and no breastfeeding. Hepatitis B, we're going to give HBIG and the hepatitis B vaccine to that baby. GBS, make sure to screen that mom 35 to 37 weeks and give her penicillin during labor if she's GBS positive. Rubella, no MMR in pregnancy and vaccinate postpartum. CMV, saliva and urine, and make sure they perform good hand hygiene. HSV, C-section with active lesions, and avoid breastfeeding or kissing if there's lesions present. If you remember nothing else, remember that TORCH means we're protecting that fetus by protecting that mom. All right, you're ready for TORCH infections on the NCLEX.